Good evening, and thank you for joining us. My name is Tony Ince, and I'm the Minister of African Nova Scotian Affairs. And as well, I'm the moderator for this information session this evening. Joining me are Dr. Gaynor Watson Creed and Lindell Wigginton. Hi.
How you doing?
Both, before I begin, I would like to do a brief introduction of both. Dr. Gaynor Watson Creed is Deputy Chief Medical Officer of Health for the province of Nova Scotia. She previously served as Medical Officer of Health for the Capital Health District Authority and the IWK Health Center. She is a native of Prince Edward Island who graduated from Dalhousie University Medical School in 1999. Dr. Watson Creed is a passionate advocate for the role public health plays in advancing health equity. And also joining us, and many of you may already know, is Lindell Wigginton. He is a pro basketball player for the Iowa Wolves of the NBA G League. Before starting his professional career, he played 1 year at Prince Andrew High School in Dartmouth before crossing the border to join Oak Hill Academy in Virginia. Lindell played basketball for the Iowa State Cyclones and was named one of their best players. Thank you both for joining us. We want to make sure that everyone is receiving accurate and up-to-date information about COVID-19. We also want to make sure that everyone is taking this very serious. I'm sure many Nova Scotians have a lot of questions about COVID-19, and that's why we're here. Lindell has some questions for Dr. Creed. So Lindell will be asking Dr. Creed questions, and Lindell, take it away.
All right. Thank you, Minister Ince. Hi, everyone. Thanks for tuning in. We are currently going through some very unusual times right now. Major events are being canceled. Sports leagues are being put on hold. People are working from home, and schools are being closed. So we're in everything feels like it's on hold right now. And like many Nova Scotians, I don't really understand the COVID-19 pandemic that's happening in our world today. But I'm very happy to get on here and get on live and to get this information out there to many Nova Scotians and other people around the world who may be watching this. Dr. Watson Creed, I hope you're ready for my questions. I have a lot of questions, and I hope you're ready to get it started.
Bring them on.
All right. So the first question, what is COVID-19 and how is it spread?
Okay. So COVID-19 is a virus, and it's a virus that's similar to a lot of the cold viruses that we see every year. So people know what a cold is. They get that all the time. The challenge with this particular virus, it's called a coronavirus, is that it's one that we've not seen before, and it looks more dangerous than any cold virus or influenza virus that we've seen in the past. In fact, it looks more like the virus that caused SARS. So if people have heard about SARS, that was called severe acute respiratory syndrome. That was a similar virus, coronavirus, that we saw in 2003. It looks more like MERS, which is Middle East respiratory syndrome. That's a coronavirus that we saw a little later than that. I think it was around 2010, 2011, something like that. Those were more serious than your average coronavirus, and this one is too. In fact, this one actually is being named basically as SARS coronavirus 2. That's the official name for COVID-19. And that's why, it's because it looks so much like that previous one that we saw. In terms of how it spread mostly in two ways. And these are the things that often folks really need to understand about this particular coronavirus. So this is a virus that lives in your respiratory tract, which means it lives in your nose, throat, lungs, basically. And that's where it is most comfortable, and that's where it's going to cause the most damage as well. So to get out from there, it will come out when you're coughing or sneezing. And what comes out are these droplets. And so it's gross. And some of you will have seen, for example, those pictures of, when they do a slow motion of when somebody sneezes and you see the spray go everywhere. It's that with this virus, right? Where that spray goes typically is out, and then it falls somewhere within about a 2-meter radius. So you hear us talk all the time about the 2-meter rule, and that's how far away you need to be from somebody. That's why, because the coronavirus within that 2-meter radius, if you're too close and somebody sneezes or coughs, it could actually land on you. So that's one way that it spread. The other way that it spread is that even if it didn't land on you, whatever it landed on in that 2-meter zone is now contaminated. And if you touch what's in that 2-meter zone, and then you touch your face, which brings your contaminated hands now into contact with your eyes, your nose, your mouth, you have the potential of introducing the virus into your body through one of those 3 places. And if that happens, then you're infected. So it's spread in those 2 ways. One is by contaminated hands, and the other is directly by being sneezed or coughed on.
Okay, sounds good. What should someone do if they think they have the COVID-19 virus? And when should they get tested? And how do you get tested?
Yeah. So here in Nova Scotia, we have set up testing centers now all over the province. I think there's about 13 across the province, and we continue to set up more as we identify new coronavirus activity. The way to get any of those questions answered is through 811. So when you call 811, they'll ask you some questions about your symptoms to see whether or not it could be coronavirus or something else. If it looks like it is coronavirus, they're going to tell you where the nearest assessment center is and direct you there to get tested. The test is easy. It's what we call a nasopharyngeal swab, which basically is a really kind of tiny Q-tip that goes through your nose, basically to the back of your nose, the top of your throat, basically. And we kind of spin it around so that we get enough of the secretions there that we can pull it out and send that to the lab for testing. And that's it. It doesn't take long. It's not a particularly invasive test either. But all of that can be done at the assessment centers across the province. Often folks will have other questions after that, and 811 can be there to answer those other questions, as well as the local public health office can answer them.
So for the people that don't know what 811 is, are there any other things that 811, when you call, that they do?
Yeah, so 811 is Nova Scotia's provincial telehealth service. So it's actually a free service to all Nova Scotians. All you need to dial from any phone in the province is 811, including from your cell phone, and you will get a health practitioner on the other end of the phone who can answer your health questions about pretty much anything you have to ask. If they can't answer your questions, or if they think that you need further assessment, then they will direct you to a healthcare provider, either to a family doctor, a walk-in clinic, or to hospital if they think it's serious. If it's really serious, they will actually direct you to 911.
Okay. So with the COVID virus, can it live on surfaces like a countertop, doorknobs, and if so, how long does it stay on that surface?
Yeah, good question. So I've already talked about the droplets that come out when you cough and sneeze, and then anything they land on is contaminated, right? So that does include countertops and other surfaces. We don't know for sure how long it can last on those surfaces, but right now we would say 7 hours, 8 hours, 9 hours, even up to a day. I've seen some reports of 3 days or longer. So the bottom line is, when you think you were in a coronavirus area, which really could be any area where somebody may have sneezed or coughed on something, you need to be washing your hands on a regular basis.
Mm-hmm. So everyone been talking about social distancing, and it's been going around for a long time during this COVID-19 virus. So what is social distancing in your
Yeah, so that 2 meters that I spoke about, right? The virus comes out from somebody who coughs or sneezes. It's not usually going to travel any farther than 2 meters. It's also not an airborne virus. So you can't get this virus just from breathing in the air around you. You really have to be in that 2-meter zone where somebody could cough or sneeze on you directly. That's the zone for social distancing. So when we talk about social distancing, what we're talking about is keeping that 2-meter distance between people so that if they cough or sneeze, it's not going to land on you. That's actually what it means, right? It's really important because this virus, unlike some other viruses that we see, is really skilled at spreading between people. And anytime we see people cluster together in closer than that 2 meters, we see the potential for the virus to infect people within that zone and take off from there. So we're being really strict about social distancing for that reason, because this is a virus like very few that we've seen that really takes off when people are close to one another. About social distancing for that reason.
So if I wanted to go out with my friends, how is this dangerous to what you should say, grandparents, parents, nieces, nephews? How is that dangerous to them if I wanted to just go out with my friends?
So the question is whether or not people know that they have coronavirus by their symptoms alone. And some people do, but not everybody does with this virus. So we have a fair number of people who, when they get this virus, they don't get very sick. They get a little bit of a sniffle. They might get a chill for a day. They might experience a headache or a sore throat. They don't realize that what they have is coronavirus. And so they're out with you, for example, as their buddy. And you don't know that they have coronavirus. And now you've come in contact with them, maybe within that 2-meter zone, or maybe you've touched something that they've contaminated by sneezing or coughing. You take that home to your grandparents or other family members, it can be incredibly dangerous for them. So this is a virus that around the world we are seeing that approximately 5% of everybody who gets this virus dies. A lot of those folks are people who have underlying health conditions, but not all. We have a good number of people, young people in particular, that are also ending up in ICU with this virus. So it's a serious thing.
Would me going out and going in the park to play a basketball game with my friends, would that be okay? Or even if we're practicing social distancing and physical distancing?
It's a little hard to do physical distancing with basketball, right?
Yeah.
Basketball is a bit of a contact sport. So the answer is no. And that's why so many of the sports leagues, for example, around the world have canceled their seasons, is because these are contact sports. It's hard to play these sports without either players all touching the same equipment, like the basketball, or players being in direct contact with each other, right? And so the answer for that is no. Certainly what we're saying to people is, by all means, if you want to get out and go for a walk, for example, and you don't have coronavirus or you haven't been exposed to coronavirus that you know of, take that walk. But as much as possible, take it in isolation. Don't take other people with you. Definitely not more than 5 people, and definitely keep that 2-meter space.
So I've been hearing. Oh, that's good. I've been hearing that COVID-19 only really affects like older people between 60 to 80. So should the people between the 20s and 30s, or even younger, should they be worried about the COVID-19 virus, even if they have it? Would they be showing symptoms and be affected by it?
Yeah, it's a good question, Lindell. So the answer is that we are seeing the serious effects in nearly all age groups. So here in Nova Scotia, we have had cases, from infants all the way up to elderly people. And around the world, what we are seeing is that people in their teens, 20s, 30s, 40s, 50s, 60s, 70s all have the potential to end up in intensive care units with this virus. So young people are not spared, sorry to say.
So I know what I've been doing during my COVID-19. I've just been staying in with my family, doing workouts here with my dad. But what are other activities that we can do to just get out there and just stay in shape?
Yeah, well, I think they're staying in shape in a couple of ways. They're staying in shape physically, which it sounds like you're on the right track for. And so there's, whatever you can do in your home or around your yard that supports you to stay active, we would say do that. They're staying in shape mentally. So certainly we have a lot of young Nova Scotians who've been out of school for several weeks, just getting back to it. That's going to be really important for keeping your brain exercised, because you're going to need that no matter what happens with this virus in the future, right? So there's that. And then I think they're staying in shape spiritually, and for many people that's important as well. And so that's all about doing what you can to stay in contact with your community, stay in contact with your friends, stay in contact with your spiritual community as well, through the means that are available. Social media is a great outlet for that. Devices are a great outlet for that. You know, lots of organizations are taking to live streaming events, for example, like this, so that people can at least connect, which is a good thing to do.
So the term pandemic, what does pandemic mean, and is it really that serious?
Yeah, so, you know, the term pandemic actually means an outbreak that has spread across the world. That's it. That's all it means. We've had lots of different pandemics over the years. Even since I became a medical officer, we've had lots of different pandemics. If you think about HIV as an example, this is a disease that now exists in every part of the world. It's a pandemic, right? We don't think about it in the same way that we think about a pandemic of coronavirus, because it doesn't come on as quickly. It didn't come on as quickly as coronavirus did, but it's actually, you know, killed millions of people, right, around the world. So, so that's what a pandemic is. It's a worldwide outbreak of disease. The reason that we take these ones so seriously, and, you know, I would say any pandemic is serious, but the reason that we take ones like this coronavirus so seriously is because they come up so quickly, and they have the potential to completely overwhelm our healthcare systems in a short period of time, which is what we don't want. So when that happens, it means that our capacity to get good care in our emergency rooms, in our family doctors' offices, in our intensive care units, in our operating suites, all of that becomes at risk because we're too busy dealing with these cases of this new disease, right? So we tend to act on them fairly quickly because they have the potential to just flare up and overwhelm systems. And in that respect, yes, they are absolutely serious.
What is self-isolation, and do all Nova Scotians need to self-isolate?
Yeah, good one. So self-isolation basically means putting yourself away for 14 days. And the reason for that is it comes back to what I said earlier about this is a virus that likes to get together with people and spread through people that way. If you are not together with people, the virus can't do its thing. So self-isolation is a way of us stopping the virus from spreading from one person to another. The people that we're most worried about are the people who might have come into contact with the virus somewhere outside of Nova Scotia, have brought it back to Nova Scotia. They don't know that they've done that. Those are the people in particular that we want to see in self-isolation. So right now, anybody coming into the province of Nova Scotia, with a few exceptions, from anywhere else in the world, including other parts of Canada, is required to self-isolate for 14 days. And the reason it's 14 days is because that's how long it takes for us to know whether or not you're going to actually get sick from the virus or not. If you don't get sick from the virus, we're not worried about you anymore. And you sort of go out into the world from there, practicing the social distancing and all the other. If you do get sick with the virus during that 14 days, though, that's when we can put other measures around you and now the people that have been in contact with you to make sure that they're protected from that point. So that's what the self-isolation means. It's really a kind of quarantine. You've heard people talk about COVID quarantine. That's what we're talking about, is for those folks who may have been exposed, but we don't know if they're sick yet. We want them to stay put for 14 days until we figure out whether they've been sick. Because if they do become sick and they're out and about, the potential is that they'll expose all of those people in an uncontrolled way, and we won't be able to find all of those people if that happens. It's different than what we do for people who are sick with coronavirus. So if you do develop coronavirus during that 14 days or develop it through some other exposure, then normally what we would say to folks is it takes about 10 days for the virus to clear out of your system at that point. And so it would be about 10 days before we would say that you could go back to your usual.
So if I'm self-isolating...
Does that answer the question? Yeah.
Oh, yes, that answers it great. So if I'm self-isolating, can I and should I be able to leave the house at any point in time for anything? Groceries, to get something from a aunt's place, anything?
Yeah, not really. And it depends a little bit on why you're self-isolating. So if you're self-isolating because you, in fact, have come down with coronavirus and now you're sick with it, then it's an absolute no. You don't leave your bedroom, basically, until you're not sick anymore, because you could contaminate anybody in the house. And remember what I said about this virus. This is a serious one. People are dying from it and ending up in ICU with it. We don't want that to happen inside families, right? And you don't want that to happen to your family. So if you have the disease and it's a strict isolation, you need to basically be in your bedroom as much as possible. And if you're out, for example, to go down the hall to the washroom, then you need to make sure that you were protecting the other people in the house along the way so they're not coming into contact with you, that type of thing. And public health will help you walk through how best to do that in your home environment once they identify you as a case. They'll work with you to figure out what works for self-isolation in that circumstance. If you're somebody who, for example, has just traveled, let's say you just came here from New Brunswick, and you don't know if you've been in contact with the virus, but we're asking you to self-isolate for 14 days, but you don't have symptoms, and you might not get symptoms, we might say to you, you can go for a walk around your property, but don't go any further than that. So you're not going to go down the block, you're not going to go visit friends, you're not going to go to the grocery store. It is still stay as close to home as possible. Again, because if you suddenly realize that you're sick when you're out, you've now exposed potentially all of those people who could become the next set of cases, and that's what we want to avoid.
Mm-hmm. All right, that answers the question great. Even if you don't think you have COVID-19 and you leave the house, say to get groceries, should you wear a mask, and will it help?
Yeah, it's a good one. And a lot of people are interested in masks right now, right? It's not a bad idea. It's not a straightforward thing to do. So for healthcare workers, we want them to wear masks for two reasons. One is if for some reason we have a healthcare worker who has been exposed, doesn't know they've been exposed, and they might be incubating coronavirus, they might become symptomatic. We want them to cover their faces so that if something happens while they're at work, they're not immediately exposing those patients, so we can remove them from the workplace and then manage it. For everybody else, and so the other reason the healthcare workers are wearing masks is also to be protected from being exposed by the patients that are coming in who might be coronavirus patients. So for them, it's a different situation. For everybody else outside of those settings, the real benefit of wearing a mask is covering those droplets that might come out of your nose and mouth if you sneeze or cough. That's really the reason for wearing it. It's not likely to give you a lot of protection for what comes in. It'll give you a little bit maybe if somebody sneezes or coughs on you, but not great. It can still get into your eyes, for example. All of those membranes around your eyes are just a great portal of entry basically for coronavirus. So a mask by itself is not particularly helpful protection for you to get it from somebody. It might help you, prevent you from giving it to somebody. The other problem with masks is that if your mask becomes contaminated, let's say somebody does cough and sneeze on you, getting it off without contaminating yourself, either your nose or your mouth or your hands, is really difficult. So you want to pay attention to that. So even with the mask, you still have to be doing all of the hand washing. And even with the mask, you still have to be doing all of the social distancing that we talked about, right? That 2-meter rule, you still have to respect that. So it's not by any means a substitute for those things. Probably not harmful if you're careful about how you put the mask on and take it
off. For the people who live in apartments or condos, I know me personally, I live in a condo. So for the people that live in condos or apartments, how can they safely come and go from their homes?
It's a tough one. Apartment buildings are a tough one because often you're sharing elevators with people. You're sharing stairwells with people, and particularly if you are somebody who is in some isolation because you've come from out of the province and you may be incubating it, you want to avoid potentially coming into contact with people as much as possible. So, what we're asking people to do in those circumstances is work with the landlord, see what you can do. Some buildings are coming up with, COVID-specific elevators, for example, right? Where only the people in self-isolation are using the COVID elevator. Obviously, if you're symptomatic, then again, the answer is you're not leaving your apartment, as difficult as that is, until your illness is better, right? Until that 10 days has passed. But if you're asymptomatic, then it's a bit of being creative and also accepting that there are probably going to be some limitations on your movement for those 14 days. You simply can't be out and about. You actually do have to stay.
Okay. I hear officials say flatten the curve. What does flatten the curve mean?
Yeah, I love flatten the curve. This is a good one. Okay, so Here's the idea, and you know what? I might draw a picture. Is that okay? If I draw a
Yeah, that's
picture,
okay.
so you can see. Okay. So I've talked about cases increasing, right? And I've said that they might increase. I'm going to get a good pen. What we're trying to do is prevent cases from coming into Nova Scotia. So when we start to see cases, I don't know if folks can see this. I'll start over here. When we start to see cases, what you see is that they start to rise fairly slowly, right? And eventually you'll get to a point where you have a lot of cases, and we'll call that the peak, and then at some point you're going to come down over the peak to the end of the outbreak, and then hopefully life will return to normal. Do folks see that okay? Yeah?
Yeah.
We don't know how long this is going to take. What we do know is that the higher this peak gets, the harder it is for the healthcare community to be able to keep up. So when we talk about flatten the curve, this is the curve, and we don't want this peak to get high. We want to keep it low. We want to keep it below the line that is the threshold where the healthcare system can cope. If it gets above the line where the healthcare system can cope, then we're in trouble. So when we talk about flatten the curve, that's what we're talking about. It's this curve of, how many cases do we get over time? We call that an epidemic curve. And as much as possible, we want our curve to be pretty flat so that we're not overwhelming the healthcare system. We're not reaching that threshold where they can't cope. That means that we'll have fewer cases. It also means that the epidemic might last for longer as our curve is flatter. But better to have a long, flat curve than a great big curve with a peak that overwhelms us from the beginning, and then we can't cope. You see what I mean?
Yeah, I get it.
So everything we talked about in terms of social distancing, washing your hands, keeping your droplets away from other people, following self-isolation, listening to public health when they call, all of those things are meant to help flatten the curve.
How can we get the most accurate and up-to-date information about COVID-19?
There are a few ways. So I've already mentioned 811, and the government of Nova Scotia actually has a website, COVID-19, that is called, I think it's called coronavirus /novascotia.ca. So Nova Scotians can get all of their information there. It's on the Department of Health and Wellness website. The other way to get it is through the Government of Canada's website. So again, there's a national website for coronavirus that's hosted by the Public Health Agency of Canada, and you can Google that. Those are my, sort of top three places to get good coronavirus information. There's a lot of bad coronavirus information out there, not surprisingly. All kinds of stuff that's circulating on social media platforms that's just rumor and not true, and sometimes it's people playing pranks and people looking to make trouble. So I wouldn't use social media as my first go-to. I would actually go to the Government of Nova Scotia page, the Government of Canada page, and 811, which also has.
And I have one more question for you.
Okay.
What can we do to keep our communities safe?
Well, Lindell, I kind of feel like we did some of it tonight. So by having the opportunity to ask questions, get them answered, have a conversation about what do we need to do, that's the first step. Everything that we talked about tonight, the social distancing, the hand washing, the keeping your droplets away from others, the respecting the self-isolation and the quarantine orders that are in effect, all of that is meant to protect our communities and the most vulnerable people in the communities and the people that we love, right? These are our brothers and sisters, these are our cousins, these are our grandparents that are at risk from this virus. I wish it wasn't true. I wish we were dealing with something easier, but we're not. And so I think the way to protect our communities is to keep the dialogue going.
All right, thank you, Dr. Watson-Creed. I think this is really helpful for Nova Scotians and any other viewers from around the world. Have any final words for the viewers that are watching today?
I think everybody do what you can to flatten the curve and stay safe.
All right, thank you. Back to you, Minister.
Thank you, Lindell. Thank you, Dr. Watson-Creed. That was very informative. But before we end this video conference, I want to thank Lindell and Dr. Watson-Creed for taking today's session taking time out of their busy days to do this and for sharing the information with community. Folks, this is very important. You have to listen to the health professionals. This is very important. Thank you. Thank you all for joining us. I hope all the viewers gained a better understanding of the virus, and we each need to do our part for COVID-19. Thank you, and please be safe.